Welcome back to Now Media's TV show, Pain Diaries, broadcasting here in Houston, Texas on channel 2110. We are back with an interview with Ashley Williams with Advanced Surgical of Bel Air. Welcome to the show, Ashley.
Thank you so much. I appreciate it. Thank you for having me.
I'm so excited to have you here. So tell us, who are you? What do you do?
Well, that's a good question. Who am I? So I'm Ashley Williams. I am the Administrator, Director of Operations for Advanced Surgical of Bel Air. We are an ambulatory surgery center located right in the heart of Bel Air. We specialize in orthopedics, so we do the full spectrum of orthopedic care, shoulder specialization, total joints for the knee. We do sports medicine cases for the knee. We also do minimally invasive spine procedures. We also have a hand and wrist specialist, and we have a foot and ankle specialist from the orthopedic specialty realm. We also specialize in ear, nose, and throat procedures, pain management procedures as well. And we also do some plastic surgery cases.
Awesome. I was so fortunate to be able to do the first surgical case there a couple weeks ago.
Yes, congratulations.
Thank
you helped us break in. We very much appreciate you, and that was a great day. We had a great patients, great staff, and a great surgeon, so great physician, very good.
It was an amazing experience. It's a new state-of-the-art center. The staff is amazing. Everybody's so friendly, so clean and state-of-the-art. So it was a privilege to do a case there, and I look forward to doing so many more.
Absolutely. So yeah, kind of going into that, I didn't really talk about the facility as much, but we, like I said, we specialize in ortho, ENT, pain management, and plastics. We also are a brand new build out. So we are new construction, like she said, state-of-the-art facility. We have 3 operating rooms, fully staffed, functional, and ready. We are state licensed, and we're seeking AAA accreditation. We'll have that soon. We're going through the whole accreditation process. Our model's a bit different. So we're proud members of the FMMA, Free Market Medical Association, and that is kind of the basis of our model. It's different. We do not take traditional insurance in the realm of Medicare or Medicaid or our traditional commercial insurances. We accept direct payment plans, so direct payers, self-funded insurances, cash pay options. So the model's a bit different, but it's very rewarding. We get to look at more of price transparency for patients. We focus on quality of care for patients, and actually just everyone knowing what they're getting up front and one transparent bundled price for the surgical procedure.
Oh wow, so that's really interesting. And you call that the Free Market Medical Association.
Mm-hmm.
And so how do you sign up for that if you're looking for medical care?
Yeah, so the goal of Free Market Medical Association, so first of all, they have a website that you go to. You can search Free Market Medical Association. It's very easy to find. And Dr. Keith Smith, he is the founder of one of the founders of the Surgery Center of Oklahoma. He's one of the founders of the FMMA, and he kind of developed this association to bring the seller and the buyer together for price transparency. Their model focuses on value, price, pricing equality. So it's really, truly an effort to bring healthcare to a point where we know what we're getting and we're paying for when we go to have a procedure. And that kind of ties into our surgery model of, if you need a procedure, we will tell you up front what that procedure costs and what all you're going to get included in that bundled package. And it's very good for everyone involved, so it's a good model.
So when you say bundled surgical services, does that mean like an office visit that's included with the surgery and post-operative care too when you go after the surgery to make sure everything's okay? And what if there's a complication? What does that all entail?
So that's a great question. And we are able to customize all of our bundles. So we want to make it as easy for the physician, as easy for the patient, easy for everyone involved. These bundle packages include everything that you need to have your surgery. So as a patient, you're going to have your anesthesia fee included, your facility fee, any supplies related to that actual procedure are included on there, your professional fee that's paid to your surgeon. All of these things make up a surgical procedure when you go into a larger facility to have this done. So if you go into a large hospital, this is what they charge you, but you just don't ever really know the breakdown of each thing. So with a bundled surgical package, we package that up front. We tell you, here, this is what the price is going to be, one total. If you want to know what each one is, we can break it down for you. The only kind of external factor that may be involved in there is I try to include every implant that that could potentially be included in that surgical procedure, but if there's some extraordinary circumstance and the implant costs 3 times the amount that it would normally, that's the only extra piece, but you will know that up front. After your consultation with the physician, you will know that you need something extra, and we'll include it in that bundle. And to answer your question about if the consult is included, so we try to include the initial consult, we include all surgical procedure fees, we include after physical therapy on some of our procedures, total joint, total knees, total hips. We include an X amount of physical therapy visits afterwards. We can include DME, so any durable medical equipment that you'll need to have going home, we'll include that. So really it's customizable based on the patient, but most of our bundles are very comprehensive and they include everything you'll need for surgery.
Oh wow, that's really fantastic. And when you're talking about having these bundled surgeries, what kind of patient can actually have surgery at Advanced Surgical of Bel Air?
So that's a great question as well. We get that all the time. So with us being a non-traditional insurance facility, our patients come from a variety of referral sources. So the patient can call us directly if it's a patient that wants to pay cash and they just are inquiring about it, they can call. So cash pay, direct pay. Secondly, we have patients that have high deductibles. So if you have a deductible that's, $7,000, $10,000, and the procedure that you need is $3,500 or $4,000, then some people opt to just pay that price up front without having to go through their insurance, their deductibles. So that second option is high deductible insurance plans. The third one is a big one, so it's self-funded employer groups. And this is an area that a lot of people don't realize is out there, but we contract with employers that have opted to take their employees' medical benefits into their own hands. And so that's called self-funded employer groups. And they've essentially decided that they're cutting out the intermediaries. They do not need those third-party people involved that kind of orchestrate the health plans, and they are taking control and ownership of all of their employees' expenses. So we have a group of self-funded employer groups that we contract with, and when their employee needs something, they're referred to us. If they need an orthopedic consult, they refer it to us, and we can take it from there.
So can a small business that is a self-funded business reach out to Advanced Surgical of Bel Air and contact you directly to contract with them so that all their employees can have services through you all?
Absolutely. So if the business is interested in contracting, self-funded, they can reach out to us. Also, we have a lot of people that are just curious if they have a certain insurance and that's not a self-funded plan, what are the options there? And I just encourage everyone to reach out. If there's a procedure, if there's something that you would like done at our facility and you need us to talk to your HR department or your employer group, whoever, we can do that. It doesn't hurt to open the lines of communication there. And a lot of times there are options beyond what we even kind of see up front. If we need to do a one-time service provider agreement with that employer group, that's a possibility as well.
So the options are endless is what you're saying.
Absolutely. Yeah, we're very flexible, and that's one of the benefits of being in this free market space is that we're not held captive to kind of do what the traditional realm is we're doing everything legally, we're doing everything per our guidelines. We just have more flexibility to really have that level of transparency with the patients, with the physicians, with the employer groups, everyone involved.
You didn't sign the contract with the insurance companies, so you're not held on a leash to follow their exact rules and to be paid what they dictate as payment for a certain procedure. And you have that flexibility and laterality to allow patients to really get what they need without being constrained in what the insurance dictates as a rule. So that's really fantastic.
Absolutely. And also the patients really find that this model allows for more of an elevated patient experience, because we're not this high volume kind of machine just taking in patient after patient, almost treating them as a number. We treat our patients very individualized and customized, and that starts with the bundles. When we get that referral from the beginning, we look at what does this patient need, who is the best fit in our surgeon credentialing pool of who we can send this patient to, and so they can get really specialized care.
Okay, well, that is amazing information. I think we should continue our conversation after a commercial break. We'll talk more about the surgery center and then other services that are also available through Advanced Surgical of Bel Air. I look forward to hearing more when we come back with Pain Diaries. Hi, welcome back to Pain Diaries. I'm Dr. Suzanne Manzi, and I have Ashley Williams here with me talking about Advanced Surgical of Bel Air and bundled payments for procedures and the Free Market Medical Association. There's a lot of amazing options out there that, we can get treatment as patients, and we don't have to go through insurance companies technically anymore, because there's options that we have now. So welcome back, Ashley.
Thank you so much. I appreciate it.
So to continue our discussion, I wanted to talk about what's a little bit confusing to me in learning about this new model. Can you describe the flow? So let's say I have my primary care, and then that primary care recommends I go see a surgeon. How do I get to you guys? Or is my primary care, can they be part of this group? Or how does that all work?
Yeah. So we have, it goes back to the different referral sources, right? So you have your cash pay. Those patients, they don't need a referral. It's truly, if you are having knee pain and you think you need an orthopedic consult, you call up, we get you set up with an orthopedic surgeon. So that's one avenue. When you are with a self-funded employer group, you usually have a care navigator, someone that goes on and helps you to coordinate this care. And so when you're with that employer group, you have a designated primary care doc that you're going to, or however your plan is set up with them. So you go to your primary care doc, they recommend, they do an MRI. They say, okay, you need to go see an orthopedic surgeon. So then at that point, that care navigator looks at the patient's location, looks at the surrounding facilities, who's in network with their self-funded employer group. So basically, who's contracted to take these self-funded plans. And we are one of the very few in this area, not only the state of Texas, that work exclusively with self-funded employer groups. So we pop up for the Houston kind of surrounding area. Once we are on the platform and they're able to locate which facility that patient can go to, they send us a referral. It comes electronically to me. I look at it, I make sure that we have a physician or physicians that can accommodate this patient's consultation. From there, I reach out to the patient. I give them the options. I say, hey, if you need a knee procedure, I have these 3 docs. A lot of times I'll send the biographies to the patient via their email. They can research it, do whatever they need to do to feel comfortable with that surgeon. These surgeons are credentialed with my facility. From there, they make a decision. We set the patient up for that new patient consult. They go in for the consultation, and from there, they're scheduled for surgery if it's indicated.
Okay, so that's very, very simple.
Yep.
Much more simple than I thought it might be. And how about primary care physicians? Are you contracted with them, or are they part of this free market group?
Yeah, so that's a whole nother segment. So there's actually a movement that's direct primary care physicians, and it's truly a concierge type experience. So where these doctors are passionate about providing that patient with an elevated experience. They're of the same mindset. Free market, they don't go through traditional insurances. So a lot of these docs will set up programs, and it's almost like a membership program. The patient, if they sign up, it's a monthly fee, and a lot of times the monthly fee is not that much. And they have access to this primary care doctor, I won't say 24/7, but they have their cell phone numbers. They have providers inside the office that they can reach at all times if they have questions or they have concerns. They can do a lot of the traditional screenings that need to be done, the lab work. So it's really great experience. You cut out all of the hassle of trying to get insurance approval, go through authorization, get pre-approval for visits and waiting. There's a lot of times no wait for these types of physicians. You just have a direct line of contact with them.
Yeah, that's fantastic.
Yep.
I wanted to also ask you, I know Advanced Surgical of Bel Air is the surgery center, and then you have 2 floors in the new building. Let's talk about the first floor and what kind of services you offer there.
Yes.
I know you have an MRI machine in there, which is a big deal because everybody needs an MRI before having surgery usually.
Yes, so we have our surgery center, as I mentioned, it's a full medical professional building and brand new. We are on the 3rd floor. The first floor is also one of our entities, couple of our entities. We have full radiology suite. So we have a MRI machine, 3.0 Tesla. We have a full body CAT scan, so CT, 128 slice. We offer x-rays, ultrasounds. We also, within that, and all of these services are on that bundled plan as well. So these are all free market healthcare options. And so if a patient wants to pay cash for that imaging, we offer that. If a self-funded employer group's patient needs imaging, we offer that. So it kind of is the goal is to make it a one-stop shop to where that patient can come to one location and get everything that they need.
That's fantastic.
Within that, just aside from the radiology, there's a couple of entities there as well that are really exciting. So advanced body scan, that is preventive imaging. So that is really kind of giving the public access to take their own health into their hands, to be proactive about their care. And we live in a world, or a country, we'll say, to where access to medical treatment is not as easy as we think it is. And in order to get these diagnostic imaging studies, a lot of times you have to have symptoms. So if you go to their doctor, it's really kind of hard to get an MRI or a CT or some kind of diagnostic study without having significant symptoms. And so we offer you the capability to come into our facility and get these screenings being asymptomatic and having no symptoms. And so the goal of that is to find things that are going to not only early detection, so early detection save lives, that's kind of our motto. We want to find these things and get a hold on them before they progress and get worse inside your body. One other thing with that is, so if we look at what kind of kills people these days, it's number 1 killer is heart disease. The number 2 killer is cancer. So all of these scans that we do, especially the CT full body, we're looking at that heart. We're able to scan it, we're able to give a calcium score, and you get that report. You get it in your hands, you can get the imaging reports in your hands, everything. So we kind of are giving that to you after the scan and letting you be proactive about your health care.
That's amazing. I mean, I don't know who wouldn't want to do this. I mean, I want to know what's going on, and obviously I take really good care of myself, as do you. And to know if you can be proactive about something before it starts, before you even have to suffer from symptoms and get things treated, you know, it's huge. That's really a game changer for a lot of people. Is it expensive?
So we offer different packages,
Okay.
and the best thing to do is just schedule an appointment. It's
Yeah.
free to make a consultation. It's free to make an appointment. We can give you a tour of the facility. You can see, you know, what equipment we're using. Within these packages, the offers that we have, we can customize it. There's the full body CT. We do an MRI of the brain with a neuro reader component of it that's an AI algorithm. So it's AI technology.
Oh, that's neat.
What we do with that is scan the brain, and we can detect early Alzheimer's, dementia, vascular changes of the brain, volumetric changes of the brain, and then kind of moving to the full body scan. We scan from the shoulder to the thighs, and so we look at everything in there, all of the organs, the lungs, the heart, liver, spleen, pancreas, prostate. So you'll get a full report on that. And we have a board certified radiologist that this is what he does. He reads these whole body scans and dictates a full report with all the findings. Two other services we offer is thyroid. So there's a thyroid ultrasound and also carotid ultrasound that's included in those packages as well. So those are really important components that we need to look at as well.
It's all about anti-aging, right?
Mm-hmm. Yes.
What can we do to prevent complications, heart attacks, feeling bad in the future, even cancer detection? Because cancer can be asymptomatic for so long, and then all of a sudden, when you're symptomatic, it might be because you're actually a stage 4, which is
Yep.
metastatic spread throughout your body. So this is a great technology that's offered. I'm so excited for this.
Yeah, speaking on that, we find cancer at the very beginning stages of it. So you have stages 0 through 4, and we're finding cancers at 0 and 1. So we're able to give you that information, and you take control of it and get that removed. Or if it's a type of situation where it's kind of a watch and wait, you at least know it's there. It's having that knowledge, and the knowledge is essentially power. It's power over your health.
Yep. And that's, you know, a lifetime that you can spend longer with your kids and your family and friends and just living life to the fullest. And that's what it's all about.
Yep.
Thank you so much, Ashley.